Hello. Good evening, fellow friends and loved ones. Yes, I'm honored to come to you this evening, the 20th of September 2020. It's a special day, 2009-2020. Yes, it's a very humbled privilege to come to you to continue our discussions. Yes, we've had series of continuous discussions on so many conditions. Yes, clinical conditions. We've had scoliosis. We had anterior. We've had ankle lesions and ankle osteochondral lesions. We had talks on Bell's palsy. We've had talks on so many conditions. Yes, there are so many. The latest one we had was on delayed developmental milestone, DDM, delayed developmental milestone. And then we were able to talk about how when a child is born, the various stages that the child is supposed to go through. And then when he or she misses a stage, we could tell that the child has a condition. And then we diagnose the condition as delayed developmental milestone. Today is a special day, and we are talking about a condition called drop foot or foot drop. So the clinical condition is called drop foot or foot drop. Okay, so our outline for this today is we can talk about the anatomy, the condition itself, the pathophysiology, that is what happened before the condition comes about, that is foot drop, the signs and symptoms, the causes, the diseases that lead to this condition, how to diagnose this condition, the treatment. Okay, so the treatment that this condition is given to, so when one has this condition, what treatment is being meted out to, and then lifestyle and home medication. So if you have this condition, what are you supposed to do in the house? How are you able to manage the condition in the house? And then precautions, various precautions that are necessary to be taken to be able to reduce the incidence or the likelihood of having this condition. Okay, so we are zooming on to talk about the condition. Yes, so there's a quote that says that it's better you take a step than to wait to be drawn down into the drain. So we are taking a step today to talk about the condition drop foot or foot drop. Yes, they look intertwined, they look confusing, but they mean the same. Researchers have shown that foot drop is the same as drop foot because they present the same. Okay, so foot drop is basically a physical manifestation of a clinical condition. So when I say physical manifestation, that we see it could be a condition that is within, that's a disease within us. That's when the doctor diagnoses, we could manifest in a condition called drop foot. Okay, so when someone has drop foot, you could see the foot going down. That is you not being able to raise your foot up. So we'll be seeing some pictures very soon as we do on the condition. So when someone has foot drop, how the foot will look like, and then we can be able to appreciate this condition. Without pictures, I'm sure we all will be in space. Imagine how this condition will be like. Yes, so foot drop. Yes, so this is a condition that we all need to know so that we can be able to treat this condition. So first of all, every part of the body is composed of structures. That is, when you talk about anatomy, it means the various components of the body that come together for us to perform functions. So every part of the body, we have muscles, we have ligaments, we have tendons, we have bezels. We have so many structures that helps the body coordinate and come together to be able to perform function. So in the foot too, we have structures that we call ligaments. We have blood vessels that carry the blood from the heart to the foot, and we have nerves, we have ligaments, we have muscles. They are very important structures that help the foot to move. So when we have dysfunction or injury to that structure, this could lead to this condition called job foot or foot job. Okay, so there's a structure that we call a nerve in the foot, and especially when this nerve is injured, when this nerve is affected, that is, we have maybe the nerve is cut off because maybe the person has had an accident. This could cause the foot to drop. Okay, and this nerve is called common peroneal nerve. So let's see a presentation of this condition. Okay, so we could see this picture here. Yes, so we can see it very clearly here. So we can see, we can observe it well. This is the normal foot. Yes, the normal foot. So you have the normal foot here. Yes, so this is the normal foot. You can see this is a normal foot, and then this is the foot job. This is the foot job. Yes, the foot job. You see that the normal foot is quite straight, and the foot job, you could see this reddish sign here that shows that the foot has gone down the normal length or the normal position. Yes, it has dropped from the normal position, and to the condition will be termed as foot drop. Okay, so I believe this picture is a very, very good summary of what foot drop is. Yes, it will give us a very, 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 very easy way to describe this condition to anyone. Okay, so we mentioned a nerve known as common peroneal nerve. Yes, it's a very, very important nerve that when it's injured, the foot can drop. So you could see that when the person raises the leg up, the foot that is not able to raise, and then it's kept in down. Okay, so, and when this is noted, especially in a hospital, we could use various tests to be able to see whether there's an injury to that nerve. Okay, so this nerve can be palpated from the head of the fibula. When I say fibula is a bone in the leg. There are two bones in the leg known as tibia and fibula, and this helps the leg bone to connect to the hip bone at the knee. So these bones are very important to give shape to the body, and so the nerves pass through this bone called the fibula. It goes round the fibula and then goes down into the foot to the toe. So we realize that when we are walking, we're able to move the toe and then the toes, especially the big toe. And so when this nerve is affected, that's the common peroneal nerve is affected, it causes the ability of the toe not to be able to raise up, and then consequentially that is also results in the foot not being able to. Okay, so we've talked about the common peroneal nerve. Yes. Okay, so damage to this common peroneal nerve could result in inability to raise the foot up, so the foot drops, and then we can diagnose this condition as foot drop. Okay, so the symptom of this condition is a greater problem and not the disease itself. So what it means is that the disease that is inside manifesting outside is just the presentation. Okay, so we have the peroneal nerve being affected, and then the foot drops. So the foot drop is just a presentation of what has happened inside. Okay, so now we are talking about the pathophysiology. So when we talk about pathophysiology, is the condition in how it affects movement. Physiology means the ability of the body to move in a particular way. So physiology, so or the physical manifestation of the structures in the body. So this results in impairment of the structural position of the body. So we have inability for one to raise the foot up, and then also this can affect one of the foot or both of the foot depending on the condition or the medical condition that it comes with. Okay, yes. So yes, we've been talking about the condition job foot, and then we are on pathophysiology. Yes, so we realize that when the person is walking, if someone has job foot, we realize that if one of the foot is affected, when he raises one foot, the other foot is not able to raise up, and so one of the foot drags on the ground, and then this can be very very painful or can be very very discomforting because the person feels uneasy. Yes, so this condition is mostly a neurological disorder. When we say neurological disorder, it comes from or it stems from the brain and it manifests outside the body. So the brain and the spinal cord form what we call the central nervous system. So when the central nervous system is affected, that's the brain and spinal cord, it could manifest in the condition called foot job. So foot job, yes. So this can also be manifested as the foot job by a muscular disease. So we have muscular diseases that could present itself as having foot job. So someone has a condition where he has weakness in the muscles. It could affect the foot, and this could cause the foot to drop. Okay, so basically there are two main sources of this condition called foot drop. We have the central and the spinal, and so one of the common causes or the cause of foot drop is multiple sclerosis, and these affect mainly the muscles. So you have the lower limb, that's the legs being affected, and then it affects the ability of the person to be able to raise the foot up, and this could cause the foot to drop. Some of the conditions can be treated, some of them are permanent. Okay, so when someone has this condition called job foot, we could see that there's impaired sensation. The clinical diagnosis is called dysthesia. So when you pass your hand, that is, you move your hand like this, your hand through the when you move your hand through the person's leg and try to wrap your hand to the leg, the person doesn't really feel anything, and so the person has impaired sensation. The person doesn't feel anything on the foot. Also, the person has muscle weakness. So when you ask the person to raise the foot up, the foot doesn't go up. There is weakness in the foot. And also the person has gait impairment. When we say gait impairment, when the person is walking, the person is able to raise the foot up, the person drags the foot on the ground, and this is very painful and discomforting. And also the person has reduced activities of daily living, so the person is able to perform his activities very very effectively. So especially when the person is doing a manual work. So just imagine a carpenter or even a mason having job foot, carrying the blocks to the various sites. Carrying the blocks to various sites becomes very 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 difficult, and then he or she is not able to achieve his aim for the day effectively, and this can be very 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 painful. And then person can have will not be able to achieve his aim, that is getting enough money for the day. Okay, so when we talk about job foot, we have so many causes of job foot or foot job. Yes, so the first one is trauma to the knee. When we say trauma to the knee, it means that maybe the person has hit the leg to a stone, or maybe playing football, the person hits the leg against something hard, and so the common peroneal nerve, so we talked about common peroneal nerve, is affected, and so it gets torn. So this results in the person having job foot. Yes, so Just to pause to look at some pictures, more pictures on this condition called drop foot. Yes, so that we can really appreciate this condition. Yes, so just a little see. So this is the normal foot. Yes, we talk about the normal foot. So this is the normal foot, and so this is the normal foot position. So when the foot drops to this place, the person is likely to have a drop foot, as we see here, and this is the common peroneal nerve. So when there's trauma to this side, we'll have drop foot. So the common peroneal nerve is affected. We have a drop foot. Also, one of the main cause is neurological disorders. So when the person have a stroke or CVE, the person's nerve can be affected, and this will cause the person to have a drop foot. Thirdly, person could have compression in the fibula. Yes, the fibula. So we'll look at the example of the bone, the fibula. Yes, so this is the drop foot. You could see the drop foot. Yes, I'm sure we can see the drop foot. The foot has dropped. You see the weakness. The person not able to lift the foot up. You can see the foot has dropped from the normal neutral position. Yes, so we are looking at various positions of the foot. Okay, yeah. So another neurological disorder is the stroke. Yes, so then the other cause is fracture. So we have fracture to the leg bone, so specifically the fibula. So we'll be showing some pictures to be able to give us a very detailed understanding of what we talk about a fibula and a tibia. Yes, so a fibula bone is actually a bone that also helps to allow movement, so it gives shape to the body, especially the leg. And so when there is fracture, that is when there's break to the fibula bone, there could be injury to the common peroneal nerve, because the common peroneal nerve moves around the fibula bone, and this could result in a foot drop. Also, there could be injury to the tibia plateau. So when there's injury to the tibia plateau is a point just below the knee. So there's a bone called tibia just below the knee, and then there's a point on that bone, the apex of that bone, that's the top of that bone, called the tibia plateau. The nerve, that the common peroneal nerve, passes through that side. So when it's injured, it could cause the foot to drop. So you've seen the picture of the foot drop. So just a picture of how the foot drops. So let's see how the foot drop looks like. I'm sure. Yes. Okay. So we have a picture like this. Yes. So you can see the foot drop. It's very visible. So the foot has dropped from its normal alignment. Yes. Okay. All right. So I'm sure we have seen it now. Yes. And then as we go on, we're talking more about the condition foot drop. And so we are talking about the causes of the foot drop. We talked about the fact that there could be trauma to the knee. There could be neurological disorder. That is, we could have brain injury that could cause the body to have, or the leg to have, a foot drop. There could be patella or tibia plateau fracture. There could be also fracture of the fibula, that's a bone in the leg, and this could cause the nerve to be injured, and then the foot will drop. Also, there are also various toxins, that's various chemicals, that's when they are taken in, they could cause the nerve to be impaired and then the foot to drop. Also, there could also be patellar dislocation. So when we talk about patellar dislocation, in the knee we have a small bone called the patella, and then when the patella shifts, it could cause the nerve to be injured or be displaced, and this will cause the foot to drop. Okay, so these are some of the causes of foot drop. And then we'll talk about now the risk factors. Risk factors of foot drop. So what are the risk factors of foot drop? Yes, so these are very, very weird, but let's take very important precautions with this. So one is crossing legs. So people who cross their legs very often are likely to injure this peroneal or common peroneal nerve. So if you like crossing your legs too much, it's not advisable actually to be crossing your legs too much. Yes, so let's take precautions and know that crossing your legs is not, it's not really advisable. Yes, it's not really advisable. And also prolonged kneeling. So not to debunk any religion, but we are saying prolonged kneeling can also cause injury to the common peroneal nerve, and this could result in foot drop. There's a research carried out, and then we are just supporting it. And also prolonged squatting. So if you are someone who likes squatting for too long a time, you are likely to injure your common peroneal nerve, and this could result in a foot drop. So let's take precautions, and these are some of the risk factors that could result in the foot drop. So the first is crossing your legs. The second one is prolonged kneeling or prolonged squatting. The third is actually in the hospital, so where there's someone who wears a leg cast. When we say cast, it's a hard material that is tied around the part of the body to be able to prevent the body from excessive movement, or the joints or the particular body structure from movement. So when someone injures the leg through an accident, the person puts on cast, so a leg cast. But in case where the cast is very, very tight, it could cause injury to that nerve. So this nerve is very, 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 very important nerve, common peroneal nerve. Immediately that nerve is injured, we could have foot drop, and that nerve has its mother from a nerve called sciatic nerve that comes from the buttocks region down into the knee, and this connects to the common peroneal nerve. So wearing a leg cast, that is POP. Yes. So the common name is POP. So when you have POP around the foot, this could result in injury to the common peroneal nerve. Yes. So actually this POP encloses the ankle and then ends below the knee. So below the knee to the ankle and then around the foot. So this could cause injury to the peroneal nerve, and then the person could have a drop foot. Okay, so some of the very important structures, that is the ligament around the foot that could be affected, are anterior tibialis, we have fibularis tertius, we have extensor hallucis longus, we have extensor digitorum longus. Yes, so these are some of the structures, that's the ligaments around the foot. Yes, okay, so just some of the conditions or disease that could result in drop foot. So drop foot is actually not a clinical or condition, but it's a manifestation. So we diagnose the person as having drop foot by the manifestation that the person's foot has dropped, but the actual condition is internal, that is manifested outside. So we have stroke, we have amyotrophic lateral sclerosis, we have muscular dystrophy, we have poliomyelitis. So someone having poliomyelitis, I'm sure we'll have some pictures of poliomyelitis after this discussion. We'll have some pictures of poliomyelitis that will see that the foot has dropped, but it doesn't mean that the person has foot drop as a clinical condition, but manifested as foot drop because the person has poliomyelitis. Another condition is Charcot-Marie Tooth disease, multiple sclerosis or multiple sclerosis. We have cerebral palsy. You've talked about cerebral palsy, yes, in the previous presentation. And then so the child has a foot drop, and also we have hereditary spastic paraplegia. So the person is not able to move the foot, well, the leg is very weak and it's not able to move. We have Guillain-Barré syndrome. We'll be talking about this in one of our presentations. And then we have the Welander distal myopathy. We have Frederick's ataxia. And then very important one is hip replacement surgery. So when someone goes for surgery at the hip, there's likely that maybe the surgeon will touch a nerve called the sciatic nerve. So immediately the sciatic nerve is touched, it runs down into the foot, and this could cause the foot to drop, and then the person could have foot drop. And also we have knee ligament reconstruction surgery. So in the conditions where we have osteoarthritis, a severe osteoarthritis, the knee joints can be removed, and then an artificial one can be put inside the knee. At the point where you are putting the artificial knee into the leg, there could be they could tamper with the common peroneal nerve, and when it tamper with it, this could result in the foot dropping. So the person could have foot drop, and this is very important that we should take note of. Okay, so if someone has foot drops, how will you know? And then how will you be able to treat this condition? So there are various diagnoses that we could use. That is we use, and we have X-rays, we have CT scans, we have MRIs, and that we go through. So they will also tell us whether there's a growth in the bone, that is the fibular bone. So when there's a growth in the bone, it could also pinch the nerve called the common peroneal nerve, and this could cause the foot to drop. Also, we could have tumor around the fibular bone, tumor, that is a cancer around the or growth around the fibular bone. Yes, and this could result in a drop foot. Also, we could have cyst. So cyst is a growth that grows around the structure, and this could also impinge upon the fibular bone. Yes, and we could have ultrasound. So a doctor could request for ultrasound to be able to see if there's any swelling around the joints or around the fibular bone, and this could help us to be able to diagnose this condition as foot drop, that is the foot dropping. And we have MRI also. MRI to the knee or to the leg will give us a detailed presentation of the condition, whether there is a dislocation, yes, to the bone. And also, when we notice that there's a foot drop and a dislocation, it's important that we treat this as individuals. So when the foot drops, we treat the foot and strengthen the muscles of the foot to be able to hold the body in place. And then if there's a dislocation, to make sure that we shape the bone or the patella back into its normal alignment. Other than that, we can't treat one condition and isolate them and treat the other condition and not treat the other condition. Okay, so we have also nerve tests. So we have a process called electromyocardiogram or nerve conduction test, and this is the activity of the muscles and how strong the foot is or the leg is, and this will help us in giving effective treatment to the condition. Yes. So when we are now coming to the treatment of this condition called drop foot or foot drop. Yes, so treatment of this condition depends on the severity. So some of the conditions are that the nerve is totally cut off, that is, there's really nothing to do about it. And when it's noticed early, there are various treatments such as going through surgical means, that is, we transplant a nerve from a strong site onto the foot or the regions around the foot where there's no movement, especially around the ankle to the big toe and then to the knee. So this helps to regenerate the nerves there and then strengthen the foot so that we don't walk by dragging our foot on the ground. Yes, and then another one is we have a brace or a splint. So we'll show you some braces very soon. Yes, so we have some pictures of braces that we can show. Just a minute. Yes, so we'll be showing you some braces. Yes, some braces. Yes, so this is a brace actually. Okay, yes. So yes, so this is the brace we are talking about. Um. Okay. So we can be able to appreciate this. Yes. So yes, this one brace. Yes. So it helps us to hold the foot in place. Yes, hold the foot in place. We called it the ankle foot orthotics. Yes, so this is a brace, this another brace. So it's an ankle foot orthotics, and this helps to hold the foot in place. So you can see one part of the back of the leg being held in place, and the foot also sits in this support. Yes, it's called an ankle foot brace. An ankle foot brace. This helps to hold the foot from dropping. So an earlier presentation of the foot dropping as this. So you can see that yes, this is a progression, a daily progression. So you see that the foot dropping this way. We can see this thing, the foot dropping. Then when the person wears the ankle foot, the foot is kept in a neutral position, and then the person is able to wear the shoes without the foot dropping and then dragging on the floor. Okay, so yes, so we've seen an ankle foot brace. Yes, so this is one way of holding the foot in place to be able to perform activities of daily living very effectively. Also, we have physical therapy. So in the stage where there's some movement in the foot, we have exercises such as tiptoeing. We have exercises such as stimulation. Yes, stimulations. We have nerve stimulation where we use machines to be able to strengthen the structures around the foot. We have nerves around the foot, so we have nerve stimulation, and this helps to increase the sensation around the foot. And then when the sensation is upped, it's increased, it indirectly stimulates the muscles to be able to perform activities such as raising the foot up and down. Yes, so you have nerve stimulation, and then surgery we've talked about, where we have the nerve being transplanted from one side of the body to the affected side, and this helps to increase activity and then help the foot to perform its function of moving up and down and then walk effectively. Okay, so now we'll talk about some precautions, some lifestyle modification. So when we talk about lifestyle modification, what are we supposed to do to be able to prevent this condition called foot drop? Yes. So we have to keep all floors clear of clutter. So if there's anything that is likely to cause us to fall and then have trauma to our foot, we have to prevent it. So all floors, if the floors are tiled, they should be cleaned, and then they shouldn't be wet, because wet floors or slippery floors could result in falls, and when there's falls, there's likely to injure the peroneal nerve, the common peroneal nerve. Also, we also have to avoid use of tool racks. Also, avoid oils on the ground and on slippery floors, and this could cause injury to the foot, especially the common peroneal nerve, and this could result in job foot or foot drop. Yes. So also we also have to move electrical cords away from the walkways so that we don't tipple off. So if there are cords or electrical wires on the ground, it could cause us to tip off, that is topple off, and then we could fall and injure our foot, and this could result in foot drop. Last but not the least, so also we should also make sure that there are lights in our room. So that means that when there are lights out, we should take precautions in our walkway, especially when we have stairs, so that we don't fall off. Because when we fall off, we are likely to injure this part of the body called the foot, and then the common peroneal nerve, and this could result in drop foot. Yes. Also, we also have to place fluorescent tips at various stations, where in the case where we don't have lights, so the fluorescent tips could reflect light and helps us to see as we walk. Okay, so we talked about the lifestyle modifications, and then now we should know that anyone can have drop foot. Drop foot has no respecter of age, has no respecter of class, has no respecter of gender. So anyone can have this condition called drop foot. And so when we notice it, or when we notice that irrespective of our age, we need to see the appropriate health personnel, that's the medical practitioner, to be able to treat this condition. First of all, drop foot can be temporal, can be treated, and then the foot can resume its normal function. Some of them are permanent because the injury to the foot is very severe and nothing can be done about it. So that's where we come in to use the various AFOs, that is what we've shown initially, the ankle foot orthotics, to hold the foot in place in order not for the foot to drop. Okay, so ankle foot orthotics, yes. So a summary of what we've talked about so far. Yes, we've talked about the condition called foot drop or drop foot, and then the fact that there's a particular structure called the common peroneal nerve. Yes, when it's affected, when it's cut off, this could result in the foot dropping, so we can't raise the foot up. So when you ask someone to raise the foot up, the foot cannot come up, and this can be treated, or this can be managed. Yes, okay. And then we talked about the fact that the causes, and then we talked about the risk factors. We talked about how we can diagnose this condition, the pathophysiology, how they present, the signs and the symptoms, and then most importantly, how we can manage and then treat them. Okay, so ankle foot orthotics help us to manage this condition in the case where they are permanent, so that the foot can be held, and then there is no injury or severity of this condition. Okay, so you talked about drop foot, and I believe that we've learned a lot. And the fact that drop foot can be temporal, can be permanent, and the fact that surgically we can treat it with exercises too. We can treat it to be able to strengthen the structures. Okay, so I believe we are all ears and we've understood to the latter. Yes, so if you have any questions, you can ask. Yes, we talk about drop foot. Yes, so just some pictures of the condition drop foot. Yes, so that we can, yes, so some pictures of the drop foot. Yeah, so these are some of the pictures of the drop foot. Yes, so so these are the ankle foot orthotics. So you can see the ankle foot orthotics. Yes, so ankle foot orthotics. Yes, so that's it, the ankle foot orthotics. These are the ankle foot orthotics that helps to support the knee. So we can see the structures in the ankle. Yes, the ankle. Yes, so the foot is supposed to come up like this, as this, but when it drops like this, yes, the foot drops. Yes, so you see the normal foot. So when you ask the person to raise the foot up like this, rather the foot, the heel goes up instead of the foot going up like this. See the normal foot movement. So when the common peroneal nerve is injured, instead of the foot going up like this, the heel goes up. Yes, so the heel goes up and the foot still lies on the ground. And so with a test like this, we can say that there's an injury to the common peroneal nerve, and then the person has a job foot. Okay, so this is one example of the ankle foot orthotics. Yes, so this is the ankle foot orthotics, an example of it. Yes, so this is a movement that are expected in the body. This is another ankle foot orthotics. So yes, so another one. So there are so many ankle foot orthotics that another one. This is another one. This is really nice, a nice one. Okay, another one. Okay, so there are so many. So there are so many. So this brings us to the end of our discussion on ankle foot, on job foot. Yes, on job foot. So the ankle foot orthotics are the various ways of supporting the foot to hold them in place. So we've talked about job foot and the causes. I believe that we've learned a lot, and that we were to pass on knowledge to others. And various pictures will be shown after this presentation, and then if you have any questions, you can visit our Facebook page, that is RICOY, yes, on Facebook, and then you can pass your comments. Any questions, please? Any questions? Yes, I see so many. Yes, online. Yes. If you have any questions, you can pass it on, and comments are also welcome. Yes, all comments are welcomed. Yes, we have some few minutes to. Yes. Yes. Okay. So. Yes, I'm a physiotherapist, and yes, we go through various exercises to. Okay, this question is: I'm a physiotherapist, and we go through various exercises to be able to treat the condition. Yes, and I believe we can treat this condition, and then also we can manage this condition. Yes, okay, yeah. So we can manage this condition exactly. Physiotherapists can manage this condition to the maximum, where the person is able to carry out activities of daily living very effectively. Yes, so that's one role of a physiotherapist, where the condition is not so severe. Yes, okay. Any question again? Okay. So we talked about job foot or foot job, where the presentation is that the foot drops when they ask the person or the person to raise the foot up. The person cannot raise the foot up. So you can see the foot. So if you have the foot like this, just imagine this is my foot. The normal thing is that I'm supposed to raise my foot up like this. Yes, but then the foot cannot go up, and the foot rather goes up this way. Yes. Okay. So this is the end of the presentation on the topic foot job or job foot. I believe that we learned a lot, and then our next topic will be told us tomorrow or Tuesday. Yes, and we have our topic in place, but we will bring it out on Tuesday. Yes, I believe we learned a lot. Have a blessed evening. Yes, have a blessed evening, and take care. Bye. See you. We love you. Bye.